1. Isaac, turning the conference over to you. Thank you.
Thank you so very much. Hello, everyone, and thank you for joining us today for our third vaccine town hall presented by the LA County Department of Public Health. My name is Isaac Cuevas. I am the Director of Immigration and Public Affairs for the Archdiocese of Los Angeles, and I'd like to welcome everyone who's joining us virtually tonight. We have 4 of LA County's Department of Public Health top experts in medicine science here to answer your questions about the COVID-19 vaccine, where we are right now, and where we're heading in the months ahead. Over the course of the next 90 minutes, we're going to cover important vaccine-related topics, including who can get the vaccine as of right now, safety updates, facts and myths regarding the vaccine, and we will also walk through the distribution process here in LA County. Now, we're going to make every single effort to answer the most common of questions, and we're going to start with a discussion between our 4 panelists for about 30 to 45 minutes. This will then move us into additional questions that have been submitted through the chat. Now, so far, we've received over 800 questions in advance, and while we won't be able to answer them all, we are going to try our very best, so please be patient. Now, as a reminder, you can submit your questions at any time during this town hall in the comments section of YouTube and Facebook, or on Twitter using the hashtag AskCOVIDTownHall. And if you would like to listen in Spanish, you can do so by calling 888-664-1453 using any phone that you may have. Si gusta escuchar esta presentación en español, por favor, use su teléfono marcando al área 888-664-1453. Una vez más, ese número para escuchar esta presentación en español es 888-664-1453. Now, let's begin our introductions with our first panelist. First up, we have Dr. Muntu Davis, who serves as the Los Angeles County Public Health Officer. Dr. Davis, if you'd like to give us some opening remarks, please.
Thank you, Isaac, and thank you everyone who's joining us tonight. If you're wondering why we're a little bit late, it's because I had a technical difficulty and actually shut down my computer when we were supposed to start on time, adjusting the monitor. So appreciate everyone for being here, and thank you for your patience. As many of you have been watching over the last several weeks, I know that all of you have seen we are starting to see some steady progress in reducing the average number of daily new cases of COVID-19 that are being diagnosed here in Los Angeles County. And the 7-day average number of daily cases by episode date, that is the date that it was actually occurred, has now decreased to less than 1,000 per day. We're very thankful that we're returning our average case numbers down to levels that we saw prior to our surge, and we're hoping that they continue to go down as we continue to move forward. And these declines here are real, and we're grateful for the choices that have been made by many of you and the businesses here in LA County, and the work that everyone has done to make this possible. In addition to the lowered cases, there are an increasing number of Los Angeles County residents receiving the vaccine. And as of February 25th, we administered almost 2 million doses of vaccine in Los Angeles County. Of these, almost or a little bit over 600,000 were people who received their second dose, meaning that they're fully vaccinated against COVID-19. It takes a couple weeks for that full effect to come in place after that second dose, but that's where we are at the moment. In addition to healthcare workers, residents, and staff at long-term care facilities, and people who are 65 and older, starting this week, 3 additional groups are eligible for the vaccine. These include education and childcare workers, food and agriculture workers, and emergency service workers, including law enforcement, which Dr. Kurian will talk about here shortly. We're excited about the possibility that now Johnson & Johnson vaccine has received the emergency use authorization. LA County will likely begin to see doses of this vaccine as early as this week. I do want to note that as Johnson & Johnson doses come into Los Angeles County, This vaccine will be offered at a number of sites, including our megapods, and all three vaccines that have been authorized are extraordinarily powerful, and in clinical trials were 100% effective at preventing hospitalizations and deaths. And these are our two most important measures as we look at our infections. Please know when you come to a site that there will not be an ability to choose your vaccine brand, as all of the vaccines we have are available to offer, have protected people from serious illness that required serious illness that would have required hospitalization and death. There has also been a lot in the news recently about variants of interest and variants of concern, particularly the UK variant, which is officially known as B.1.1.7. There are now 18 confirmed cases of that variant here in Los Angeles County. And to date, we have not found any cases of the South Africa variant. The question we're asked most often is if the vaccines are effective against the variant. And scientific research suggests that currently available COVID-19 vaccines against the variant are effective for the UK variant, but vaccine supply is still limited. The local transmission potentially more infectious with the UK variant. It underscores the need for Los Angeles County residents to use every tool that we have to prevent transmission, including not gathering with people you don't live with, and distancing and masking when you're out of your home and around others. And with that, Isaac, I'll turn it back over to you. Thank you.
Thank you so much, Dr. Davis, and we definitely share in your optimism about the numbers coming down. So hopefully that will continue, and we'll get into a little more of that as we move on with the program. Next up, we have Dr. Sarah Kurian, who serves as the Los Angeles County Department of Public Health Director of Medical Affairs. She's also one of the leaders on the vaccine efforts for the County of Los Angeles. Dr. Kurian, thank you so much for joining us.
Thank you, Isaac. So as Dr. Davis mentioned, 3 additional sectors, which include education and childcare, emergency services and first responders, as well as food and agriculture, are now eligible for vaccination. So if you work in one of these sectors and either live or work here in LA County, you're now eligible to be vaccinated. We estimate that over 546,000 people fall into the education and childcare sector here in LA County. I do want to note that private nannies are not considered eligible in this category, since we've received many questions about this. For public schools, select school districts may be operating their own pods or points of dispensing to immunize staff and teachers in their districts. Those school districts not operating their own pods are partnering with local hospitals, health centers, or pharmacies. K-12 teachers and essential education support staff can also receive vaccinations through county-run megapods or through their healthcare providers. Many of the independent schools are partnering with local school districts to vaccinate their K-12 teachers and essential education support staff. Independent school staff can also receive vaccinations through county-run megapods or through their healthcare providers. In addition, county-run megapods have designated particular days for vaccinating teachers and essential workers at independent schools. Early care and education staff are a particular priority for vaccination, since this group has been working through the duration of the pandemic and in fact are anxiously waiting their opportunity to get vaccinated. These workers can receive vaccinations through the county-run megapods, their healthcare providers, or through any community site that are set up, including pharmacies and healthcare clinics. Childcare workers can also get vaccinated at county-run childcare worker-only megapods at all 5 of our large capacity sites. In addition, Children's Hospital Los Angeles is vaccinating early care and education workers. Information on vaccination sites for the childcare sector is also available at Pathways LA resource referral agencies. There are an estimated 502,000 people working in the food and agriculture sector in LA County. And like other sectors, this group can be vaccinated at county-run megapods or through other healthcare providers. We have also designated particular days for vaccinating this sector at our megapods. Albertsons and their affiliates, including Vons, Pavilions, and Save-On, as well as Costco and Ralph's grocery store pharmacy chains, will provide vaccination to in-store food distribution and transport workers for these chains. grocery store workers who do not work at a facility providing vaccination through on-site pharmacies can get vaccinated at county-run food and ag only megapods, where appointments are reserved for workers in this sector. In addition, they can, of course, access any other available appointments at vaccinatelacounty.com. The grocery store workers that are members of the UFCW 770 union will be vaccinated through mobile vaccination clinics in partnership with Curative. The union has more information on how both members and non-members can connect with that opportunity. Food manufacturers in the city of Vernon will be vaccinated by the Stacy Medical Center through both on-site locations and mobile units. I want to note for this sector in particular, there are multiple ways to verify your employment that does not include a government-issued ID or an official pay stub, and I'll talk more about that in a moment. Because this sector includes a wide variety of occupations, from agriculture workers to restaurant employees, we know that significant outreach efforts need to be made to reach these eligible individuals and assure that they know where they can go to get vaccinated. We are partnering with people and organizations that not only reach these groups, but are also trusted by them. This includes workplace and community leaders, media outlets, and promotoras that are helping us connect this community with opportunities for vaccination. Finally, an estimated 116,000 people in LA County work in emergency services and as first responders. All the agencies in this category have been partnered with their associated fire department or police department or public health department. Jurisdictional law enforcement entities have partnered with EMS and clinic stakeholders to administer vaccine to their workers. The Los Angeles County Sheriff's Department and the Los Angeles Police Department have partnered with LASD, Emergency Services Detail, and Los Angeles Fire, respectively. All the city police departments have partnered with LA County Fire Department, local hospitals, or local fire departments to receive vaccine. The County Corrections and the Department of Probation will be vaccinated through the Department of Health Services or public health clinics. Large school police departments have all partnered with an allied health system or with LA Unified School District. UCLA and LAUSD has committed to vaccinating all school police departments that have not established prior vaccine partners. Specific emergency service individuals, including eligible court personnel, can get vaccinated at county-run emergency services only megapods at all 5 of our sites. The largest federal agencies, including the FBI Field Office, TSA, and Customs and Border Protection, have been partnered with LA Fire. Additionally, select federal entities are partnering with local VA hospitals to receive federally allocated vaccine. The state and federal correctional facilities will receive vaccine through their respective parent agencies. When you go to get your vaccine, you will need to show documentation that includes a photo ID, though it does not have to be government issued. You also need to show proof that you either live or work in LA County and proof that you work in a sector that is eligible to be vaccinated. For some people, one document may show all of these, like a work badge that has your photo and address of your workplace on it. Other people may need to bring pay stubs or other documentation that shows where you work. There are dozens of documents that can be used to verify eligibility, and a list of accepted documents on our website, vaccinatelacounty.com. Thank you, Isaac.
Incredibly helpful. Thank you so much, Dr. Korean, and great to see and hear that we are now open for new sectors. Now, allow me to introduce Dr. Nauman Shah, Associate Chief of the Healthcare Outreach Unit, who's going to speak to us a little bit about the vaccine distribution here in LA. Dr. Shah, thank you so much for joining us.
Thank you, Isaac. So as you know, LA County, like everywhere else, we've been incredibly strained by the short supply of vaccine. We have every week the capacity to do over 500,000 vaccinations. Last week, we only had enough doses for 270,000 appointments. County and City of LA sites alone will be vaccinating 130,000 people combined. Our federally qualified health centers and community clinics are administering almost 56,000 doses this week, with pharmacies contributing another 34,000. We are shifting some of our allocations to these smaller sites to make sure that providers that serve our hardest hit communities are able to vaccinate more people. We've really promoted sort of a strategy of access with more than 500 sites across the county. I want to note just a huge word of thanks to our vaccinating partners. They are doing this in the evenings, on the weekends, day in, day out, with a lot of uncertainty and without really any promise of recompense. Across sectors, we do have even though we have much more capacity to vaccinate, we just really need vaccine at this point. Our large megapods from public health alone could be providing an additional 142,000 vaccinations a week if we had sufficient supply. As we note, our most under-resourced communities in LA County have, which are the ones that have seen the most cases, the most hospitalizations, the most deaths. These same inequities are playing out again with vaccine, and it's unacceptable. We have lower coverage rates in those areas that have been harder hit and have less access, but we're trying to create new partnerships and strategies to make sure that the vaccine can be accessible and people can get vaccinated barrier-free. So some of these strategies include more restricted clinics for people who live in these communities. We face challenges with that as well. The access codes that allow people to sign up on a priority basis have been leaked, and unfortunately, individuals have jumped the line, taking up these valuable slots. We are increasing the number of mobile teams that can visit people who cannot travel for a vaccination appointment, and we're partnering with faith-based and community-based organizations who can directly reach congregations, clients, assist them with registration, and one of our large capacity sites, or will be offering pop-up sites at their house of worship or within their community itself. In terms of our large vaccination sites, the county megapods, for people living in hard-hit communities, we've been working on having options for transportation so that they can visit one of those sites and receive their vaccine. A little bit more about the mobile teams. I think this is some of the most exciting work. We now have over 20 different mobile teams through various partners that are going to be visiting particularly harder hit communities as well as older adults who are homebound. This week alone, 46 teams will visit 26 affordable senior housing developments, 20 senior residential communities, 30 of which of these sites are in South LA and Antelope Valley, which are really hard hit areas with a shortage of healthcare access. So we're hoping that this will help improve the equity, but ultimately we still really need more doses to make use of the capacity we have. Thanks for having me here, and I'm happy to discuss other strategies that we have in mind throughout the night.
Thank you so much, Dr. Sean. Thank you for bringing up the topic of equity. It's definitely been a topic that we've discussed at length. And also just to further underscore your commitment to reaching our communities, I do want to say that a big part of the reason why I'm here is because of these conversations that we've had, and the LA Archdiocese and our Catholic Church network here in the county has made itself accessible to all of these resources and locations. However, again, as you mentioned, it is the supply that is the biggest challenge so far. So we will continue to make ourselves available as the supply increases, and hopefully we can also help and partner up with you all. So thank you for your work and what you've been able to do so far. Finally, Dr. Eloisa Gonzalez, who is the Director of Cardiovascular and School Health for Public Health and is also working as a liaison for COVID response. Dr. Gonzalez, thank you so much for being with us here tonight.
Isaac, thank you so much. It's a pleasure to be here. And thank you to everyone actually for being here tonight. I know my colleagues have covered already a lot of ground, but I really want to take a minute or two to clear up some common misconceptions about the COVID-19 vaccine and also how people get the vaccine. So to start, I want to emphasize that the vaccine is free. Everyone in LA County will receive it at no cost to them. There are some medical providers who may charge a small upfront fee, but that will be reimbursed through your insurance. Secondly, as long as you live in Los Angeles County or are a part of the eligible essential workers who work in Los Angeles County, you can receive the vaccine, regardless of your immigration status. At no point will you be asked about your immigration status as well. It's also important that everyone is aware of who is currently eligible to receive the vaccine. I want to emphasize that if you are not in one of the eligible groups, being either a healthcare worker, age 65 and older, an education or childcare worker, a food and agriculture worker, or emergency service worker, you're not able to be vaccinated at this time. We have gotten reports that the MyTerm system has some issues with allowing non-eligible people to make appointments. If you are able to make an appointment but are not in one of the eligible groups, please cancel your appointment and don't come to the vaccination site. You will be turned away. As Dr. Kurian pointed out, people coming to be vaccinated will be asked to verify that they're in an eligible group, and anyone that's not able to do this will not be vaccinated. And just to restate, private nannies are not included in the education and childcare sector, and so they're not eligible for vaccination at this time. And jumping the line is taking away vaccination appointments from those highest at risk of getting severely ill or dying, which could be your family or friends or family members. We do ask that you please continue to be patient and wait your turn. And finally, I want to remind everyone that has received the vaccine that it is critically important that you all continue to wear your mask and distance. The vaccines are very effective and will keep you from getting seriously ill or dying. But until enough people in our community have immunity, either through getting COVID-19 or receiving the vaccine, we must continue to use all of the tools at our disposal. Thank you, and now I'll turn it back over to Isaac.
Thank you so much, Dr. Gonzalez. And yes, indeed, using all of your PPE is incredibly important while we go through this phase of making sure everyone is inoculated. Thank you again, Dr. Davis, Dr. Kurian, Dr. Shaw, and Dr. Gonzalez for your insight and for being with us here tonight. Now, let's turn our conversation over to our Q&A portion of the town hall, where we're going to be answering questions that have been submitted in advance. Please remember that you can still continue to submit questions using the chat function either on YouTube, Facebook, or via Twitter using the hashtag AskCOVIDTownHall. First question is for Dr. Shaw. How was Johnson & Johnson able to create the vaccine with just one dose while the others are 2 doses? And Dr. Shaw, does this make it any better?
Thanks, Isaac. Yeah, it's a great question. I think a one-dose strategy was adopted by the company in order to get a product out there as soon as possible. It's always a bit of a risk because we never know what's going to work until we did the trial. Luckily, the trial shows us very clearly in more than 40,000 people of all ages, all races, across the world, comorbidities, that it's an amazing vaccine with 100% efficacy against severe disease, against hospitalizations and against deaths. Now, there is a Johnson & Johnson second trial underway looking at that same vaccine with 2 doses to see if that might make the immunity last longer. But for now, 1 dose protects you, and it's fantastic. The Pfizer and Moderna trials, it was just a decision by the company to use a 2-dose series, understanding that's the best chance at a high level of protection, and they did achieve that. There is further work going on to look at how effective 1 dose alone is, but for now we know that 2-dose, the complete series, protects you, so either option is excellent. Don't know if there's
and as you mentioned before, obviously, the important thing is to get whatever is available at the time that you can get an appointment. So that's key and important. Thank you so much, Doctor. Next question is for Dr. Kurian. Are people with underlying conditions going to be able to get the vaccine starting March 15th? And if so, what documentation or verification will be needed for people to get vaccinated?
So really good question. So the state has currently allowed for those between the age of 16 and 64 with certain underlying conditions to get vaccinated starting on March 15th. So essentially, healthcare providers can use their clinical judgment to really determine who is deemed to be at sort of the very highest risk to get very sick from COVID-19 because they have one of those health conditions. And these can include things like cancer or having a currently weakened immune system, chronic kidney disease or chronic pulmonary disease. So providers who have access to vaccine, they can use their own medical records to kind of identify patients who qualify and vaccinate them. For those providers who don't have access to the vaccine, we're waiting for additional guidance from the state on really what type of documentation other providers are going to need in order to vaccinate these patients. So in sort of the absence of additional information from the state, we will establish some of our own criteria, and most likely at present, we're thinking perhaps a letter with that's sort of an attestation from the physician stating that the person meets the criteria for one of the conditions on the state list. But again, this is something that we're still working through and deciding. We will get additional guidance from the state soon on this.
And as soon as those guidance are made available, I'm sure we will be updating the county website. So we'll stay tuned for that. Thank you so much. Next question is for Dr. Davis. Positive cases, you mentioned this earlier, Dr. Davis, positive cases are dropping and they're dropping very quickly. Is this because of the vaccine or some other reason? Just like you, I worry that we may be reopening too quickly. Dr. Davis, would you mind giving us your opinion on the matter?
Yeah, I think it's a combination of a number of different things. One, we've had a significant number of infections, and we had a significant number of people get infected in a short period of time, thinking about the holidays. We've also had a good number of people at least get their first dose. I mean, again, almost 2 million people, which does give some protection, but the second dose gives the full protection. And at the same time, I think a lot of people really did what they needed to do, especially coming through the surge with so many cases. I know a lot of people who were very afraid and really stuck to the preventive measures that were needed in order to prevent from getting or spreading COVID-19. So I think it's really a combination of the three. But when we think about the time that we had the surge, we were in that holiday time where we're all used to getting together. And for many people, it was tough, to have such a drastic change. And so we think a lot of the travel and those holiday get-togethers, were things that really drove what we saw. So hopefully what we're seeing now continues and people continue to follow those measures so that we don't have another surge should we have more variant cases or other things that start to show up.
Thank you, Dr. Davis. So important not to let our guard down right now that the numbers are decreasing, but yet the virus is still very much present. So thank you for that. Dr. Gonzalez, next question is for you. Can an employer mandate that its employees get vaccinated?
Thank you for that question. So it really depends on your type of employment. For sure, an employer may require employees to wear personal protective equipment during a pandemic. And, in cases where an employee has a disability that needs related reasonable accommodation, like, provision of non-latex gloves or gowns designed for individuals who use wheelchairs, things like that, the employer should provide those absent any undue hardship for the provider to do so.
Thank you so much. Dr. Korean, next question is for you. If I'm a food service worker who lives in LA County, but I work in San Bernardino County or any other county, let's just suppose, what county should I get vaccinated in? I'm assuming this is a very common question being that LA is so vast.
Yeah, no, absolutely. It is a good question. And, we do recognize, especially when we are talking about some of these work-related sectors, that folks may live and work in very different places. And, folks are very used to commuting, even sometimes pretty far distances in order to get to their work. So in terms of meeting eligibility criteria here in LA County, as long as you either work or live in LA, you are eligible to get vaccinated. So even if you're just living here, but you're working in another county, you can still get vaccinated here in LA County, as long as the eligibility criteria that you belong to one of the sectors that are currently eligible for vaccination, and that when you show up to the vaccine site that you bring in the documentation that's required. And it's really sort of three things. One, we need a photo ID. The second is, again, some sort of proof that you're either working or living here. So something that has the address of where you live if you're living here in LA, or the address of the facility that you're working at if you're working here in LA. And then the third is just, again, some sort of proof that you belong to this one of the eligible sectors. But, should be able to get vaccinated in either county, but you're definitely eligible here in LA County.
Great. And Dr. Gonzalez, since I work in immigration affairs, I get this question a lot. Immigration status, is that required for getting the vaccine?
No, thank you for that question. Absolutely not. So immigration status does not matter when it comes to vaccine eligibility. Regardless of whether you're here legally or not, you are eligible as long as you live within Los Angeles County and are a member of one of the eligible groups that is able to currently get vaccinated, then you can be vaccinated. We'd never ask about your immigration status.
Wonderful, and thank you so much. Quick reminder for everybody who's late and tuning in, thank you so much for joining us. We're here talking about the COVID vaccine, and you can enter your questions either in the chat via Facebook or YouTube. You can also submit questions with the hashtag on Twitter, #AskCOVIDTownHall. Dr. Shaw, the next question is for you. The question goes, I've heard that I can get the vaccine at Rite Aid or CVS. Is there somewhere I can go for additional information?
Thanks. It is confusing keeping track of all the different sites where vaccine is available. The best resource is the Department of Public Health website. It has a map of all the vaccination sites and a link to all of the different sign-up systems that might be nearest to your community.
Fantastic, and thank you. Dr. Korean, why are most sites drive-through? Is this question that's coming in. And the question follows up with, I don't have a car and a walk-up site would be best for me. Can you provide some insights?
Sure. So a lot of the sites are drive-through, mainly because it does offer some degree of convenience for folks who may have to travel far to find an appointment. And it also allows folks to kind of stay in their vehicle, get vaccinated, and then also go through their observation period without having to leave. But we completely understand and recognize that this sort of method does not work for all, and that not everyone has a car or a vehicle. So a couple of our county-run vaccination sites are actually walk-up, and this includes our El Sereno and Balboa locations. Similarly, some of the sites that are run by LA City also offer walk-up options. So you can check vaccinatelacounty.com, and it does provide information on which sites are walk-up and which ones are drive-up only. The other thing to keep in mind is that there are also, a number of pharmacies and clinics that are on that webpage that also offer vaccination without having to drive up.
That's vaccinatelacounty.com. Thank you so much, Doctor. Next question for Dr. Shaw or Dr. Davis. Why has there been a prioritization of cities with higher rates of cases?
So as we think about the burden of disease, you often think about, where has the disease been? Where are the places that need the most protection? So we look at those areas with the idea that if we can get those areas vaccinated or people in those areas vaccinated, we won't see that same increase in cases or the same burden of disease that we've seen, before, during this pandemic. So the idea is to protect those who are most at risk. And clearly from the data, those areas have been most at risk. So we want to make sure that they are protected moving forward.
And completely agree with Dr. Davis. Just to add on from the allocation standpoint, I think as I alluded to before, the communities that were hardest hit with the highest case rates are also the ones that generally are the poorest, the most under-resourced, the struggle for healthcare access. And we've absolutely been trying to increase allocations to those areas, where in February, our doses were stagnant. We did not have any increase in doses for the entire month. In fact, we had a decrease some weeks, and yet we were still able to direct more vaccines to South LA, East LA, places that would be some of the highest case rates.
And I'll also add really quickly, these are also the people who have been working throughout this pandemic as well. So I do want to acknowledge that, many people have been working throughout this whole pandemic and have been impacted by it. So we want to make sure they're protected. Thank you.
No, that makes all sense in the world that the working class also get taken into consideration. So thank you for focusing on the needs and the equity there. Dr. Korean, you mentioned earlier that nannies were not eligible. This question is for you. Nannies work in intimate household settings, and a majority of them are people of color in Los Angeles. Why are they not eligible for vaccines under the child care category when state guidelines explicitly allow for nannies to be vaccinated in phase 1B? This person also wants to note that nannies are also able to be vaccinated in many other counties under the child care category.
So yes, thank you. And we do get this question quite a bit. I think, as was alluded to, I think several times in this meeting so far, is that we've been getting very limited quantities of vaccine coming into the county, and on the flip side, we have very large numbers of individuals in each of these sectors that we have to vaccinate, and so we have to prioritize vaccine for those individuals within the sectors who really are at the highest risk of exposure to COVID-19. That's sort of really the framework with which we work in terms of identifying individuals who are eligible. So when you look at nannies, individuals who are caring for just children from one household are at much lower risk compared to those who are caring for children from multiple households, which is sort of the case for teachers and those in daycare settings. As we sort of try to determine who we would include in terms of eligibility, we had to go through these sort of prioritizations. For us, nannies were lower on our risk and lower on risk level in terms of who we were going to strategize to vaccinate.
Thank you, Dr. Korean. Dr. Davies, Dr. Gonzalez, this next question is about the safety around the vaccine, and it goes like this. My aunt isn't sure she wants to get the vaccine. She says, we don't know if it works yet. What can I tell her? Are fewer people dying from the vaccine?
So
Okay. Do you, Dr.
I'll go ahead and start. I'm sure you can add to this. So the vaccines were studied in terms of their effectiveness, in terms of protecting people from both serious illness as well as hospitalization as well as death. That is the reason that they were authorized for use during this time. And when we look at what we've seen in terms of even looking at the studies themselves, there weren't deaths related to the vaccine in those studies. And as we look at the data moving forward, we're not seeing that as well. Does that mean that people haven't died? Yes, they have died, but is it related to the vaccine? That's not what we're seeing. The causes of death, even during the studies, were natural causes moving forward. So the vaccines were studied in order to their effectiveness, and that's why, again, they were authorized in terms of the emergency use. Dr. Gonzalez, you want to add to that?
Well, just wanted to potentially add that, as we announced, I think, or Dr. Ferrer announced earlier this week, when we look at the data of healthcare workers who've been vaccinated, the number of healthcare workers who have died was much greater prior to broad vaccination of that population than it is now that a good majority of them have been vaccinated. So that's an indication in any way, an early indication that the vaccine may in fact actually be working towards getting the people who are in these groups of mass vaccination to have lower death rates, if you will, overall.
Noted. Thank you so much. Dr. Shah, this next question is about the quantities of vaccine and this lack of access, the supply issue. Why are there still so few vaccines available, and why can't these medical providers just make more?
It's a great question. I want a little perspective here. So, a year ago, if we would have thought we would have had 3 different licensed vaccines right now, and they worked as amazingly as they did, most people would be astonished. So I just want to recognize how far we've come as a medical community, as a public health community. We've given out 2 million vaccines. There are not enough, and we want more. That is still a huge number. This is the largest health operation in the history of the US. So while we do desperately need more vaccine, and we wish there were more, it is obviously straining everyone's capacity. As a small example, it's not even just about the vaccine, the liquid and the vials. last month, Moderna had more vaccine on hand, but ran out of the little glass vials because no one has ever had to make so many millions of them so fast before. So I think the Biden administration is doing a lot of work with manufacturers to try to figure out what are these critical choke points that are restraining supply and working on expanding them. We need more, but it's taking a step back, I think it's pretty amazing what has happened to date.
We've never had to deal with something like this, so I'm imagining that there's a lot of learning that's still going on and happening with the production line. Thank you so much for that answer. Dr. Gonzalez, yeah, is it safe to breastfeed after receiving the vaccine? This is coming in from a mother.
Yes, we have a lot of mothers and prospective mothers in LA County. So I'm glad for the question. We've actually been getting it quite a bit. In fact, there's no evidence at all to indicate that there's any negative sort of ramifications for women to get immunized, whether they're pregnant, breastfeeding, or planning to become pregnant. There's no damage to the or risk to the pregnancy itself or to the developing fetus. So I think individuals who have specific concerns about getting vaccinated during pregnancy or during lactation, certainly it's always best to consult with their doctor, but overall it should be fairly safe in any of those categories: pregnant, breastfeeding, or planning to become pregnant. To be vaccinated should be safe.
Very important for all those babies that are quarantine babies. Thank you so much for that answer. Dr. Korean, I have personally, I have a teenager at home, and I've wondered about this question myself. The question goes, my son works in a restaurant, so he qualifies for the vaccine, but he's 16 years old. Can he still get the Pfizer vaccine?
So yeah, good question. So yes, of the 3 vaccines that are now available or shortly will be available, the Pfizer vaccine is the one vaccine that is allowed for individuals 16 and over. So yes, he would be eligible for the Pfizer vaccine and should try and look for a site that offers that vaccine. And we do try to make sure and indicate that on our vaccinatelacounty.com webpage, which particular vaccine is offered at these various sites. Because vaccines are under emergency use authorization, you will probably need to accompany him in order to provide consent since he is considered a minor. It's also probably a good idea once he gets to the clinic site just to remind the staff at the visit that he is 16 and he does require a Pfizer vaccine, just to make sure that everybody understands and recognizes that he is 16 years of age. And just as a reminder, he does need to make sure that when he goes in for his second dose, that the second dose also needs to be Pfizer.
Absolutely, and thank you so much. Great point about making sure that because they're a minor, they are going to need a parent with them. Now, is it just one parent, both parents? Does it matter?
No, it's just a single parent or a legal guardian.
Wonderful. Thank you so much. Dr. Davies, this question is for you. And I get this question a lot. Do we know yet if the vaccines also prevent the transmission of COVID?
That's one thing that we're looking to see, and more data will be gathered. As the studies were done, they were really looking at the effectiveness of the vaccine in terms of preventing illness, hospitalization, and death. But that data that tells us whether or not a person can be infected and asymptomatic or not have symptoms and then transmit to another person, that's what will be evaluated as things move forward and more people get vaccinated. At this point, we don't know for sure, which is another reason why you have to use your face coverings and still keep your distance, especially around those who may be at higher risk of serious illness related to COVID-19 infection.
Makes sense. Thank you so much. Dr. Shaw, earlier you mentioned the success you've had with mobile units. This question is for you. How many mobile units will be in the South LA area? And because the phone systems are not working well, and some do not, and some people, I guess, do not have internet or enough minutes to be able to call in and get an appointment, is there anything they can do to facilitate that process?
Thanks, Isaac. It's it's such an important question to not take things for granted, right? Whether it's having a car, having the ability to sign online, having the time to do so. That is not available for too many of our fellow citizens, and that's why a mobile strategy really makes sense. We have over 12 teams in South LA alone next week, and they are going to reach these populations who are otherwise chronically left behind.
Fantastic. And putting on my archdiocesan hat on for a second, this is why it's so important to have that community, to be a member of a group, people that can help facilitate these things for you. So obviously we encourage you all not to be alone during this time if you can help it. Dr. Korean, who will be eligible for the vaccine after people with pre-existing conditions? When will the general public be eligible?
Okay, yeah, great. So this really depends to some extent on how quickly we're going to be moving through our current sectors. So I provided you in the opening comments with just some of the numbers in terms of how many folks we're looking at in terms of who we have to vaccinate. So it's going to take a while to get through these sectors. But we also know that the state has already said that we will be moving into pre-existing conditions starting on March 15th. So it's a little unclear whether we'll have to move through the entirety of these sectors, most likely not, before we start to move into sort of the next phases. And what the state has said so far is that after we move through the underlying medical conditions, the rest of the vaccine rollout will really be dependent, it will be based on sort of an age-based criteria. So exactly when that's going to occur is not completely clear. What the state is currently sort of projecting is that that'll happen sometime in the spring, is when we'll sort of go into the next sort of age-based phase. So in terms of the general public, it may not be until closer to the summer.
Noted, and that's actually a perfect segue into the next question, Dr. Korean, and maybe Dr. Shaw, you could also chime in on this as well. Can you give a little bit more information on that, on the strategy behind this age-based approach? And could you also answer when individuals who are between the ages of 20 and 30 be eligible?
Sure. So, one of the things that we've seen with going with a sector-based strategy is that it can sometimes be very complicated, not only for the public health department and for the vaccine providers, but also for the general public in terms of understanding, who's eligible, who's not, and especially in a situation where we've got such limited vaccine doses, it can be really hard to operationalize this sort of an approach. So I think there was some recognition of some of the challenges associated with this, and therefore a move to kind of move beyond a sector-based approach and into more of an age-based approach. So in terms, again, of when we'll move into the next age-based sort of category, the state is projecting sometime in the spring, and so this will probably be those individuals, under the age of 65, but how wide that age bracket is going to be is also a little unclear. So we're waiting for state guidance on if that will be like, 55 to 65 or some other age bracket. So in terms of the 20 to 30-year-olds, again, probably closer to late spring, early summer before we get to that age group.
Noted. Thank you so much. Follow-up question also for you, Dr. Korean. Says my son is a grocery store worker, but he's 16. Can he be vaccinated?
Sure. And this is very similar again to the 16-year-old who's a food worker. So yes, if they're 16 and they're working in a grocery store, the same sort of rules apply. They can get vaccinated. They should look for a site that offers Pfizer vaccine. And they should try and get to the appointment with a parent or legal guardian.
Perfect. Dr. Shaw, somebody asked the question saying, why can I not find any appointments even though I'm eligible? I'm assuming that this is something through the system. Dr. Shaw, can you shine a little more light on this?
Sure, Isaac. I think it's probably actually more related to the shortage of doses. We just have a limited number of appointments for a lot of people who are eligible. I think at this time with the 1B groups, seniors, food and agriculture, emergency response and services, and education, there's about nearly 3 million people combined who are eligible. And again, only 270,000 vaccinations this week. So the appointments are there, they disappear really quickly. And so it's going to take a while for us to get through everyone who is eligible and needs a vaccination.
The demand is high and supply is low. So thank you.
Well said.
Noted. And again, we're hoping that we get those numbers to increase soon. Dr. Korean, you mentioned earlier that now teachers are able to get vaccinated. Question is, how do teachers go about getting vaccinated now that they're eligible?
Yeah, so as I noted in the opening comments, there's a variety of different ways in which we're trying to reach out to our education sector. So, you know, public school districts, some of them are operating their own pods or vaccination clinics in order to vaccinate their teachers. Some of the school districts are operating their own pods or partnering with local hospitals, health centers, or pharmacies. Actually, those are for the ones who are not operating their own pods. And then some of the independent schools are, you know, linking up with their associated school districts around vaccination plans. So really the thing to do if you're in the education sector is to check in with your school administration to learn more about the options that are available to you as a staff member at your school and what strategies your school is offering up to ensure that you get vaccinated. It's also important to note that, you know, K through 12 teachers and essential education support staff can also get vaccinated through our county-run megapods or through their healthcare providers. So that's always an additional option. They can essentially go to any of the appointments that are available on vaccinatelacounty.com and get vaccinated that way as well. And then, as I noted also in my comments, that the county-run megapods are also designating some particular days just for vaccinating teachers and essential workers at independent schools. So if you're working at an independent school and you haven't been linked up with another vaccination strategy, this is another way that you can try and get vaccinated. Just go to vaccinatelacounty.com, look for the clinics that say, you know, independent school staff only, and sign up for those appointments.
Thank you so much, Doctor. And I am going to apologize. My lights have gone off because I am here in the office. And of course, we're very mindful of the energy that's being used. But I will fix that in just a minute. Dr. Gonzalez, this next question is for you. My husband received a first dose of Moderna at Dodger Stadium on February 2nd. So this was just about a month ago. And he's received no information about the second shot. And he has not been able to book another appointment. What can be done? And maybe this question is also open for anybody else about the timing of the second vaccine.
That's an opportunity to clarify the spacing of first and second doses. So for Moderna, the spacing is 28 days, and then for Pfizer, it's 21 days. So in this instance, if this person got vaccinated on February 2nd, 4 weeks later would be, you know, pretty much now, given that they got Moderna. We're really encouraging folks to go back to the first, wherever they got their first dose, to be able to get their second dose. Most places now are also going ahead and scheduling folks, booking them for their second appointment on site when they get their first appointment. The second thing that allows me to clarify is that Dodger Stadium specifically is not one of the megapods in the county that is run by us in the County Department of Public Health. The question for those who may be having a similar sort of situation that got their first dose at one of our county-run megapods is that if they're not able to get a second appointment booked officially, they didn't get one for some reason at the time that they got their first dose, they can just wait the appropriate number of days, either 21 for Pfizer or 28 for Moderna, and just come back at that time, that same day, same time, after that 3 or 4 week period, even without like an official scheduled appointment, and they should be able to get the vaccine. For Dodger Stadium, that's a city actually operated site. So I would encourage, you know, continue checking the website to see if they have options there for how you can get your second appointment booked. And worst case scenario, I would say, you may want to try seeing if, if you have the time to be able to go and potentially be turned away, you may just want to see if they could accommodate just a sort of like when you show up on site, like you could be accommodated at a county-run facility.
For a situation like this, especially because it involves Dodger Stadium, I've also heard of people who have contacted their local city council members. So that might be another option for you and another place to maybe look into. So thank you very much. Dr. Korean, are food delivery drivers like Postmates, DoorDash currently eligible for the vaccine?
So yes, food workers, including food delivery workers, are included in the food and agriculture sector and are considered to be eligible for vaccine. I also just want to note, just in follow-up to Dr. Gonzalez's question, I was getting text from some colleagues to sort of remind folks also that we do have a second dose webpage that is on our vaccinateLAcounty.com site that folks can go to get some additional information about where they can access second doses.
Fantastic, and thank you very much. As a reminder, and that kind of concludes our pre-submitted questions. So we are now going to turn to our questions that have been submitted in the chat. You can still submit questions right now through Facebook, through YouTube. Feel free to do so. And using the hashtag AskCOVIDTownHall. First question, Dr. Davies, the White House just announced that they have doses for every adult by the end of May. What does this mean for LA County?
That means we should be receiving a lot of doses, by the time that time period comes. Usually when we hear those comments, it's great to hear. We always want to see the doses follow in that regard. But if that's what they're saying, then they're projecting that production should be up and that we should have enough to vaccinate the population. But, we love to hear those announcements. We also like to see the doses come in. But that's usually what that'll mean. But hopefully they're right. And hopefully there are no hiccups and all of that. And that's actually what's going to happen.
Wonderful. Dr. Shaw, this question is for you. If a 79-year-old individual gets the vaccine and has no side effects, does that mean that the vaccine was not effective on that individual?
Great question, Isaac. So when we say side effects, I'll call them post-vaccination symptoms, which happen after every vaccine. We see them a little bit more frequently with the COVID-19 vaccines. They're just a sign of your immune system working. But just because they're not there, and whether it's a headache, a body ache, feeling a little chilled, it doesn't mean that your immune system isn't active. In fact, elderly individuals who receive the vaccine have a lower incidence of post-vaccination symptoms.
Post-vaccination symptoms. I love it. Thank you so much. Dr. maybe Gonzalez or Korean, this question is for you. How will food workers here in LA who get paid in cash be able to prove that they work in the food industry now that they're ready and able to receive the vaccine?
I could start, Dr. Gonzalez, and then if you want to add, feel free. So, we do recognize, and this was, something we really considered and contemplated a lot, because we wanted to make sure that we captured individuals who were in this situation, because a lot of times they are the most vulnerable. They are the ones who don't have necessarily a lot of access even to healthcare or other resources. So we wanted to make sure that we didn't put up a lot of barriers and prevent them from accessing vaccine. So one of the things that we have added to the list of verification documents is attestation letters. So they can get an attestation letter from a union if they're a union member. If they can get one from their employer, they can get, use an employer-based attestation letter. And if they can't get any of those, we're also allowing for self-attestation. So they basically just have to indicate their name, the business that they work for, the address of the business, and then of course bring a photo ID and something that if the letter will have the location of the business, but if their business is located outside of LA County, they need to bring in something that also shows that they live in LA County.
Wonderful. Dr. Gonzalez, anything to add?
Nope, Dr. Kurian covered it perfectly.
Beautiful. Dr. Davis, this next question is for you. And I know that we've heard a lot of conversations about these hard-hit areas, specifically as they involve Metro LA, South LA. This question is, what is actively being done to ensure Black and Latinx communities across LA County, especially in the outlying areas like the Antelope Valley or out towards the Inland Empire, Pomona Valley, for example, are also receiving the vaccine?
Appreciate that question. And as the vaccination sites are open, everyone, is eligible to go. And we are making sure that we get information out. We get questions answered, for anyone who has questions about the vaccines. And also making sure that we're partnering with organizations that, people are already working with, some of the community-based organizations, faith-based organizations as well. So they know what they need to know about the vaccine, as well as how to go about, getting an appointment or where to look for appointments. And in some instances, the organizations are helping to make appointments for them. So we're making sure that information is readily available so people have all the information they need to make an informed choice about whether or not they want to be vaccinated. And again, working with partners to get information out about when appointments are available and to get them signed up.
Wonderful. Thank you so much. This question is for either Dr. Shaw or Dr. Kurian. What happens if there are leftover vaccines at the end of the day at a vaccination site?
I can try this and then Dr. Kurian can add in. So first, it's important to clarify what we mean by leftover vaccines. There are often vaccines at the site at the end of the day, but they're kept refrigerated, so they're still good and they're used the next day. If there is an open vial and there are additional doses, we very, very carefully, after about 3 p.m. in the afternoon, open vials only to meet the needs of people who are right in front of us. And so at the megapods at the DPH vaccination sites, wasted doses, first of all, no dose has ever been wasted. It's always gotten into somebody's arm, but extra doses have been entirely minimized. Dr. Kurian, would you like to add anything?
Nope, Dr. Shaw covered it. And I'll just say Dr. Shaw is the author of some of the guidance around this issue that we've provided to our all of our vaccine provider partners. So he's really worked to make sure that folks understand how important it is to have some sort of process in place to minimize vaccine being wasted or going to folks who maybe are not eligible.
I have to say that's a tremendous amount of work, I'm sure, to make sure that you're calculating and assuring that all of that is in place. So thank you very much for making sure that those vaccines do not go to waste or that there is no excess as needed. Thank you both so much. Next question for Dr. Gonzalez. My coworker does not believe what I tell him about the vaccine, but I don't really know what else to say. Where can I go to educate him a little bit more about the vaccine?
Thank you, Isaac, and to whoever asked that really good question. We have, for a long time now, really been stressing the importance of asking someone that you trust that has got enough of an education and understanding about this to give you the answers that you have around COVID-19. So we hope that you consider the Public Health Department, a source that is trustworthy and where you can go to get more information about both the COVID vaccines that are available, as well as how you can get one and get all your other questions answered. So you can go to vaccinatelacounty.com or vacunatelosangeles.com, and if you want to read all the same information in Spanish. Both of those web pages also have links to, this, as Dr. Kurian pointed out, we have a whole page dedicated to how to get a second dose appointment. But also information about frequently asked questions. We have information about the common sort of myths that we've been hearing. So they're answered on these two websites. So I would encourage folks to, if they have any questions, to go ahead and check our websites. And if, they feel more comfortable asking, their doctor or their pharmacist, somebody who is able to understand the broader sort of COVID conversations that are going on, and that's an individual that they trust, that they go ahead and ask them.
Wonderful, and thank you so much. Dr. Davis, this next question is for you, and I believe maybe one of our diocesan clergy may have submitted this question, and you'll understand why in a second. The question is, are we allowed to travel? And if so, do we need to quarantine? And they put in all caps with a couple exclamation points afterwards, I need a vacation. So I hear this a lot working for the Catholic Church. Can you elaborate a little bit, Dr. Davis?
First off, I feel it as well. Vacations are needed by a number of people. At the moment, yes, you are able to travel. Nobody is restricted from traveling. However, the state travel advisory does say that if you're gone outside of California and returning, that you need to quarantine. And part of that is, again, sort of making sure that if by chance you might have been infected during travel, that you don't risk exposing someone else once you return. So at the moment, that's where things are. So people can travel, but again, if you go out of the state and you're returning, then you do need to quarantine for 10 days, provided you have no symptoms, and still maintain your protective measures in terms of keeping your face covering on, even after that period of time.
And I was joking, but I definitely do get that question a lot working for the diocese and being in public affairs. So the LA County website is also great about keeping those guidelines and those protocols updated as needed. So thank you so much for that, Dr. Davis. Dr. Shaw, next question is for you. This person asks, I have anxiety about taking the vaccine, but I do want to. Can I take Benadryl or something else to relax me before taking the vaccine?
Well, I will say that all four of us on the town hall right now are great at giving injections, so you have nothing to worry about. But really, all of our whole team, all of our nurses, our paramedics, everyone giving vaccines, it's really quick and painless. In terms of medications, if you are on a medicine, unless your doctor has told you to stop the medication, you do not need to stop any of your routine medications prior to receiving the vaccine. You should not take medications ahead of time before receiving the vaccine, because this can interfere with the vaccination.
Got it. So straightforward answer, don't do it. Just trust that the professionals are going to take care of you.
Correct.
Absolutely. Thank you so much, Dr. Korean. This question is from our community college sector. As community college faculty, are they eligible as educators for vaccines right now?
Yes. So yes, they are eligible under the education sector. And so they're free to, again, use any of the different methods that I mentioned earlier to try and get an appointment slot.
Wonderful. Thank you so much, Dr. Davies. This question is for you, and I think it's a very poignant question. How do we know when we've reached herd immunity? We keep hearing about this in the media, herd immunity. How do we know when we reach herd immunity, and will there ever be zero cases?
We hope that there would be zero cases at some point, but it's an infectious disease, and it's traveled across the world and has been with us for over a year in many places. So to get herd immunity, in terms of the exact number that we need, a percentage of people vaccinated inside of Los Angeles County or the U.S., that is still, trying to be determined. It's based on how infectious disease is, how easily it transmits, and the number of people that are susceptible to being infected. So it's something that we will continue to watch as vaccinations continue to go, as we start to see if people get reinfected, with the same virus. But at this point, we're still trying to figure out exactly what that percentage is to reach herd immunity. But when we start to get to that point where most people are not susceptible, most people can't be infected and transmit the disease, the case numbers will drastically go down and stay down.
Wonderful. Thank you so much. This question might be for either Dr. Korean or Dr. Gonzalez. The question is, what documents would anybody that's working in agriculture and as food vendors, specifically at farmers markets, need in order to get vaccinated?
So I can start with that one. So we have, again, on our vaccinatelacounty.com a webpage, information on all the various documentation that can be used to verify that you belong to the sector. And again, we have things like, food handler cards, certified food manager cards, a variety of things that folks can bring as proof that they work as a food worker. And again, if for whatever reason they don't find any of the things on that list that work for them, they can use the attestation letters either from their employer or, worst case scenario, from themselves.
Yeah, I might just want to add to that real quick. The entire list of documents that are able to be presented as documentation are listed in our vaccinatelacounty.com website. When you click on the book an appointment button, it'll take you to a page where you'll be able to see where what all of the documentation is that is acceptable for each of the different sectors that are eligible. So you just click on the sector that you're wondering about, and it'll pull down a whole list of documents that are acceptable at the time when you show up for your vaccine. On there, there's also links to these template letters that Dr. Corinne has been mentioning as attestation letters in case you're not able to get any of the other documents on that list. And you won't need to write a letter for yourself saying, yes, I work in this sector. There's a template letter there that you can use to be able to write that letter.
I can't emphasize enough how important it is to go in and double check what those requirements are, especially as a person who, guilty as charged, I actually went twice to the DMV to try to get my real ID, and I am guilty of not checking the website. So please do that before you go in to get your vaccine to ensure that you have all those documents in order. This next question is for Dr. Shaw. My mom had COVID a few months ago. Is it okay for her to get the vaccine, or should she wait? If she shouldn't get the vaccine, why not?
Sure, it's a great question. So people who have had COVID-19 already are protected fairly well. We don't know for how long exactly, but within the first 3 months, reinfection is incredibly rare, but it is possible. We do know the vaccine creates a stronger immune response compared to having had COVID-19, so she is still recommended to receive the vaccine. You should wait until you are done with your isolation period. For most people, that'll be 10 days. If you're hospitalized or immunocompromised, that's 20 days. The only exception is if you received convalescent plasma or the monoclonal antibody treatment, you should wait 90 days before receiving the vaccine. Your healthcare worker providing the vaccination will ask all of these questions and help you along with it.
So it's really important to know, and can you repeat that one more time, Doctor? Really important to know if you did have COVID, if you were treated for or with?
Yeah, if you were treated with 2 medications, either convalescent plasma or monoclonal antibodies, then the recommendation is to wait 90 days from your day of treatment before you get the vaccine. Otherwise, anyone else, once you're done with your isolation period, your recommended isolation period, you can receive the vaccine.
Perfect. Thank you so very much. Dr. Davis, this question is for you. It's a tough question, but one that many people obviously have in mind. When do you feel that restrictions may be lowered? Our business has been closed since March of last year, and we're struggling to make sure we don't lose our 60-year-old business.
Yeah, it's a good question, and my heart goes out to all the businesses that have been impacted by this. These measures that we've had to put in place to try to control this disease. The state has set up a framework for when certain things can be lifted when we get into what's called a less restrictive tier. Right now, we're still in the most restrictive tier, and it's by sector in terms of what can be done within that tier. And we have to adhere to that. We can't be less restrictive than the state in that regard. There is, however, some light that's starting to show. We looked at our adjusted case rate as put up by the state today. And we have two measures, our test positivity as well as our health equity measure, which are meet the criteria for a less restrictive tier. We just missed being able to qualify for a less restrictive tier in terms of our adjusted case rate, which was at 7.2. We have to be below 7. Our case numbers have continued to fall. We expect that next week we may be at 7, and we have to hold that for 2 weeks before we can consider anything less restrictive and move to the red tier. So we're hoping that it's coming soon in order to have some modifications lifted or some restrictions lifted, but that remains to be seen based on our adjusted case rate as determined by the state.
Dr. Davis, follow up to that for my own sake. Is there a dashboard or something that exists that monitors those numbers and that people can tune into online?
Yes, it's posted on the state, the California Department of Public Health's website under the Blueprint for a Safer Economy. And they post those numbers every Tuesday.
But it's the state that does that.
It's the state that does that, yes.
Noted. Noted. Thank you so very much. Very helpful. Dr. Shaw, this question is for you. When will the J&J vaccine, the Johnson & Johnson vaccine, be made available in LA County? And is there a rollout plan for the locations where it will be available?
Awaiting that answer myself. So as we've said, we find out there's incredible uncertainty. Dr. Davis alluded to this as well. We don't know what doses we're getting until we receive a notification. We receive a notification about once a week. I'm hoping to get it tomorrow about how many doses LA County will receive from its share for next week. But the vaccine will be available next week. And the plan for the vaccine, as you note, it's a great vaccine. It's one and done. It's going to be used for a lot of hard to reach populations, but also the general public. So it's a mix. We're going to use it for food and ag workers, for education, for law enforcement, also sort of farm workers and hard to reach populations, including homebound seniors. The idea is there's a lot of different places that can use it, and it works well for everyone. So it's a pretty broad strategy. We just need to see how many doses we're getting.
Wonderful. Thank you so much. Dr. Korean, I know we've talked about this previously in this conversation, but it's always good to kind of recap this just a little bit. The question is, do we have a choice? I'm assuming when somebody goes in for the vaccine, do we have a choice of which vaccine we can receive and which is safer for somebody over the age of 65?
So, as Dr. Shaw and I think Dr. Davis and maybe even Dr. Gonzalez has noted on the call so far, the thing to note is with all of these vaccines, they have incredible efficacy in preventing hospitalizations and death, and this is true even for the new J&J vaccine. So you're dealing, regardless of which vaccine that you're getting a very good choice in terms of really preventing some of the really negative outcomes. So in terms of whether you have a choice, again, our vaccine allotments are really small. And so we have very limited amount of vaccine coming into the county, and that translates to not very many appointment slots across our vaccine providers. And so oftentimes it'll be a challenge to really be able to pick and choose which vaccine you're going to get. So, different providers will have different vaccine, and we do try to indicate that on our webpage, which vaccine provider is providing which particular type of vaccine. But folks may not always be able to have the luxury of picking and choosing. So the really important overarching message and thing to remember is that all three of these vaccines offer a really good choice in terms of providing protection.
And I also want to add, again, as a person of faith and a representative of our Catholic faith, I think it's also important to note that getting the vaccine, any one of the vaccines, is important because it's the ultimate sign of demonstrating how one can love thy neighbor, love and respect, protect thy neighbor. So my quick plug for anybody who's eligible and available to take the vaccine, please do that overall for the sake of our community. This next question might be either for Dr. Shaw or Dr. Korean. Would somebody in their 30s be eligible if they have a health risk defined by the CDC, but that risk is not currently on the California list? There's a lot of confusion, a lot of misunderstandings between the federal, what happens with the CDC, and the guidelines under California. Would that person have to wait till summer if those restrictions don't match up?
Sure. The current, I'll take a stab at it. The current list is shorter than the CDC list, and the CDC list is just what's come out in research as a health condition that might be associated or is associated with an increased risk of severe COVID-19. Now, not all risks are the same, right? So given that we have a shortage of doses, and again, it comes down to what people have been saying on this town hall again and again, we are forced to prioritize because of a shortage of doses. The California vaccine group chose a smaller list that is associated, that has a higher risk of worse outcomes. So for example, cancer and being immunocompromised with cancer is on the list. High blood pressure is not. There are a lot more people with high blood pressure, too few doses, and the risk from just having high blood pressure is increased, but not as much as having cancer. We do not know yet. It depends on the vaccine availability when individuals who have a risk factor that is not on the California list will become eligible. I think it will be before the summer.
Noted, and thank you so very much. Unfortunately, ladies and gentlemen, we are out of time. I do want to thank you all for watching this very informative town hall and for so many great questions. But before we sign off and thank our panelists, Dr. Davis, Dr. Korean, Dr. Shaw, Dr. Gonzalez, one final question, and I do want to open it up for you for your remarks. When will this all be over? When can we finally throw away our masks? When can we get back to some form of normal, whatever normal will now be? Maybe we can start with Dr. Korean.
That's a really good question. I wonder that myself. So, I think it's really hard to predict. I we all wish we had a sort of a magic ball to kind of like tell us when this will all be over and we can go back to the way things were. And I think to some extent, we may just need to prepare ourselves for the fact that things may just be a new normal. Because as we sort of head into having new variants, new issues that might crop up, we just have to be prepared and ready to deal with them and continue to use the measures that we currently have to stay safe, and as you mentioned, keep our friends and family safe as well. So I think we look to the future and hope for the best, but try to do everything that we can in the moment to continue to protect ourselves and those we love.
Thank you so much, Dr. Gonzalez. Final words.
Well, I think that I completely agree with what Dr. Korean just said. I think we all hope that it'll be over, soon, but no one unfortunately has a crystal ball. We have to continue, as has been reiterated, I think, throughout this town hall, to use all of the tools available to us, vaccination, wearing masks, physical distancing, etc. But, as has also been pointed out, vaccine is still fairly scarce. And that just sort of gives rise to, fertile ground for individuals who may want to take advantage of that situation, take advantage of people's sort of desperation and want or need of, getting vaccinated. So scammers, I think folks need to be, reminded that the vaccine is always free. You shouldn't have to pay for it. You should get it definitely at a legitimate location, not in some shady, someone's apartment or some shady backyard alley distribution of vaccine. So I would say, just make sure that, you continue to stay aware of where are, trusted places that you can actually access vaccine, and until you are able to do that, and even after you've been fully vaccinated, continue to use all the tools so that we can hopefully get to that place of some new normal sooner than later.
What I'm hearing Dr. Gonzalez say is you should not have a plug for the vaccine. Noted. Thank you, Dr. Gonzalez. Let's go to Dr. Shaw. Thank you so much. Final remarks.
Well, Isaac, when will this all be over? God willing, 2021 sounds like a great year. But the first step is for all of us to get vaccinated. So don't miss your opportunity.
Wonderful. Thank you so much. And Dr. Davis, please close us out with your final thoughts.
Sure. First off, I want to thank my colleagues and thank you for hosting and moderating the panel and for all the information that's provided. I hope everyone found it useful. In terms of when this will be over, as the case counts start to go down, the risk goes down. The risk goes down as more people adhere to what they need to in order to keep their distance, wear their face masks, wash their hands, and stay away from others when they're sick. And the more people are vaccinated, the faster those case rates go down. So as those numbers go down, we'll start to get back to what's more normal for us. I don't want the new normal. So we're depending on everyone to do their part. We all are in order to make sure that this virus doesn't continue to circulate in our communities.
Thank you so much. And as a person of faith, I do want to ask you all to continue to pray for an end to this situation that we're all having to live through, but also to care for one another, be there for one another as a community in whole. And again, thank you all, Dr. Davis, Dr. Korean, Dr. Shaw, Dr. Gonzalez, for having me. I'm humbled and honored to be here with you all, and thank you for the work that you do. Appreciate it, ladies and gentlemen. Thank you so much for being with us. Have a wonderful night.